Law enforcement agencies nationwide have sought to slow the rate of coronavirus infections in jails and prisons by releasing inmates and limiting new arrests. Although New Orleans has released a few hundred people from its city jail since the outbreak began, inmates and staff are getting sick. Earlier this month, the Orleans Parish Prison Reform Coalition joined other local groups in a motorcade protest to pressure the city to release more detainees and stop new arrests for nonviolent offenses. The organization's director, Shade Dumas, has been leading the fight to connect public health to prison health.
All of the experts have said that the best way to ensure safety of the people in the jail is to decarcerate. So we need to see more efforts happening on a decarceration front. We need more efforts happening from NOPD officers to not unnecessarily bring people to the jail who don't pose a risk to public safety. Right now, our jail is under a consent decree, and we've been under a consent decree since 2013. And some of the reasons for that consent decree are improper sanitation and inadequate medical care. So if you combine those two things with an infectious disease, we have to think of the hundreds of people we're putting at risk. And we also have to think of the law enforcement officers who return to our community every day, who return to their families. So this is the big thing where I say you cannot separate prison health from public health. Our leaders refuse to see the humanity of the people in the jail. They refuse to treat people in jail with dignity. They refuse to see them as community members. And that's really where the problem is. When we understand and look in someone else's eyes and see that that person is just as human as we are, we can't act in a way that would risk their lives. There's no way someone with a heart can do that.
What is it like to have a loved one incarcerated right now during this pandemic?
It's scary to have a loved one incarcerated during this pandemic right now. I'm directly impacted by incarceration. I have a brother in prison, and my ex-husband's formerly incarcerated. One of the biggest things, you can't communicate with them as much. It puts officers at risk, so they're not going to get them and take them out of their pods. Just knowing that in a lot of parishes, people who test positive are being sent to prison facilities. So they're really just making this big old incubator where it's a larger problem.
What's the biggest thing that you hope changes as a result of this pandemic?
We should not return to business as usual when this is done. We need to redefine what a new normal is. This old way doesn't work. It has never worked. And if we see that the rates of crime is not spiking up after these people are released, then we should redefine our normal. And right now we see that the crime rate is not spiking up.
Will the pandemic force a new way of thinking about incarceration in America?
A lot of trauma is happening because of this pandemic. I'm hoping that we can learn from it on every level, with how we deal with incarcerated persons, with how we treat essential workers in a grocery store. I'm hoping that this is a learning lesson for us to recalibrate our minds and think of what's really important, who really holds the power in the community, who keeps the community going, and why should we care about prison health even if we don't care about people in prison. And I know that sounds really rough, but I think if more people understood how it connected to them, then maybe they'll have a little more empathy to the pleas of advocates. I just hope that all of this is a lesson. I don't think that we can go through this much pain without learning from it.
As of Monday, April 20th, the Orleans Parish Sheriff's Office reported 47 staff and 56 inmates had tested positive for COVID-19 in its facilities, and one staff member had died. The inmate population has been reduced from 1,071 on March 2nd to 804 on April 20th. When reached for comment, the Orleans Parish Sheriff's Office said in a statement, "We are working with the district attorney, judges, and public defenders to reduce our inmate population. We are taking the necessary steps to protect the public, our staff, and our inmates from the spread of COVID-19."